Welcome to Unbreakable, the mental health podcast for everyone, where we'll discover and understand the complex art and science behind mental wellness. I'm Gopin Pillay, and I thank you for joining me today. I have over 20 years of experience in the mental health field, working my way up from mental health technician to mental health nurse practitioner for the past 13 years. I've been treating everyday people who struggle with depression, anxiety, ADHD, PTSD, alcohol, substance use, and mood disorders. My ultimate mission with Unbreakable is to provide you with useful information about mental wellness so that you will be able to help yourself or someone you love. And also if you're a provider who treats any mental health issues. With this knowledge, I hope that you will be able to open up communication with someone so that healing can begin. Our guest today is Dr. Phillip Morris, who is a licensed psychologist specializing in psychological testing and neuropsychological evaluations. He wrote his doctoral dissertation on parent-child attachment and has participated in research studies focusing on pediatric neuropsychology. He has been an associate faculty member of the University of Phoenix since 2009 and established his outpatient practice, McKinney Neuropsychology, in 2016 with the mission to provide mental health services to the community. He is also a board member of Track for Kids, which is a nonprofit organization that provides education and services for children with ADHD and autism. For more info, please check out www.tracksforkids.org. That's www.tracks4kids.org. Episode 2, is it ADHD or something else? Thank you for joining us today, Dr. Morris. So you're a licensed psychologist who specializes in psychological testing and neuropsychological evaluations. Can you tell us about that?
So my career started about 10 years ago. And before I went off to grad school, I always knew I wanted to help kids. I always knew that was my passion, kids, teens, young adults. And I didn't know if I wanted to become a pediatrician or something else. And during that undergraduate years, I started volunteering at a treatment center for kids with social, emotional, behavioral disorders. That's kind of where I first stumbled into psychology. And it got me interested. And then I ended up applying to grad school. And I had a grad school program where it was half family psychology and then half or a subspecialty in neuropsychology. And that's when I really knew I'd hit the sweet spot because my passions for what could have been medicine, like being a pediatrician, and then neuropsychology kind of came together. Neuropsychology is all about the brain behavior relationship. So it's what different parts of the brain are responsible for different functions that we have. So
it's kind of like a hybrid approach, right?
Yeah, exactly.
Okay. So you specialize in psychological testing. Can you tell us a little bit about that?
Yeah, absolutely. Yeah, so a lot of what I do is either psychological testing or neuropsychological evaluations. They're very similar, but small difference is basically we use these different tests and measures to help clarify like diagnoses or like I said, the brain behavior relationship. So in the neuropsychology realm, we have clients who come in, patients who have had a stroke, had a head injury, have had multiple concussions, have a, unfortunate brain tumors. And so part of what we're looking at in that realm is, what's the impact on that person's day-to-day functioning? Is it going to impact their cognitive abilities? Is it going to create anxiety, depression? Are they going to lose motor movement in an arm or something? So
somebody who's had some kind of physical trauma that's caused some brain issues, right? Or mental health issues, then they would do the neuropsychological testing versus the regular psychological testing. Is that right? Yeah,
to an extent, yeah. Sometimes I think in the pediatric world, it's, with adults, it's acquired brain injuries, stroke, headache, stroke, concussion, that stuff. In the pediatric world, we look at neurodevelopmental conditions. So it's still neuro brain, but it's more like how that brain's been developing. So has something gone awry, or is there, an issue that's caused autism or ADHD or anxiety or depression? We help figure out what that is. Sometimes if we can, what caused it, but what I like to focus on more is what do we do about it? We can't turn back time and undo what's been done, but we can give that kid, teen, young adult, all the skills, resources, therapies to make them the most successful they can be, make them happy and have a fulfilling life.
Okay, so that testing will actually drive the treatment plan, or it can drive the treatment plan and kind of dictate that, right?
Yeah, that's the goal of a good evaluation is to give the patient or whoever referred the patient, whether it's their doctor, their therapist, their neurologist, their parent, their spouse, a really good comprehensive picture of who that person is from the inside and out. I like to really identify all their strengths, identify any weaknesses if there are some, and give a good picture of who they are. And then we use that information to guide what to do and develop a treatment plan. So, the testing will help clarify what diagnosis is going on, and then what follow-up therapy will come from that diagnosis.
Okay. And so then you would refer them for, let's say, medication or for therapy or a specific kind of therapy?
Yeah. Like the testing can gear what type of therapy. Like, for example, if we have a kid come in and parents are just saying, we don't know what's going on, they don't listen well, they're struggling, and let's say the testing reveals that they have autism, then we say, okay, the best treatment for autism is a social skills group or ABA therapy, applied behavior analysis therapy. Or if the testing revealed, no, unfortunately, your child's struggling with anxiety. So then it's like, okay, we'll refer for medicine, refer for cognitive behavioral therapy or a form of talk therapy. So it'll really help dictate or drive the best way to help that person.
Okay. So when is the ideal time for somebody to do psychological testing?
I mean, I'm biased, of course, because it's my life, but I'd say, everyone would benefit from the get-go.
Sure.
But I'd say a lot of people will come to testing either if they have a good doctor, a good psychiatrist, therapist, pediatrician who says, hey, I want more data on the front end to gear to drive treatment. Or the other half will come from I've been in therapy for a while and it's not working. I've been taking medicines. We've tried 2, 3, 4, 10 different medicines. My life's not getting better. Sometimes they'll come to me at that point and say, hey, we've tried, but we're obviously missing something. And so we need more information, more data to figure out what we're missing so we can get it kind of addressed and treated and change that treatment plan.
Okay. So it would be ideal for somebody to have the testing done prior to treatment. That way it can, help avoid, maybe being prescribed the wrong medication or, going to the wrong kind of therapy, or not necessarily wrong, but, not the best, right?
Yeah. That'd be ideal. Yeah.
Okay.
But unfortunately, we live, at least in this area, in society, there's still the stigma around mental illness in general. So seeking out treatment help is, a lot of people don't. And then there's even within the field, the sub-awareness of doctors, therapists being aware of psychological testing. Most of them are, but there's surprisingly a few that still aren't as familiar with it, and they don't know that that's a resource for them.
Right. That makes sense. So, and the psychological testing will actually help differentiate between the different diagnoses, so that, because a lot of the times different diagnoses will present with the same kind of symptoms, right?
Yeah.
Can you go into that a little bit in detail?
Yeah. Like ADHD, I think, is a good example of that. A good, true diagnosis of ADHD, in my mind, in my opinion, is that you've ruled out everything else that could look like it. Because there could be a kid, a young adult, who is restless, unfocused, easily distracted. And sure, it could be caused by ADHD, but there's 20 other things that could cause that too. Everything from medical conditions to other mental health conditions to situational factors. They've got a rough, maybe there's a rough dynamic at home that's, causing it. Or they've got, a medical condition that's playing out there, with something going on with their, for example, like their thymus, like their hormonal levels or something. And then even in the mental health realm, for example, you can have a kid who's appearing restless, and it turns out that's anxiety, because they're just that anxious restlessness.
So anxiety can look like ADHD.
Absolutely, all the time. Yeah, if you think about it as a kid who's sitting there and they're squirming in their chair a lot, someone may say, oh, they're hyperactive. Or they say the kid is distracted a lot. They're zoning out, or they're distracted. But it turns out that in their little head, in their little mind, they're just having racing or anxious thoughts. It's hard to sit in class, for example, focus on what the teacher's saying, if in your mind you're thinking, I wonder what they think of me. I wonder if I failed that test. I wonder what's going to happen when I get home. I wonder if my dad's going to be drunk, or whatever it is.
Right.
And so, the teacher's going to say, little Billy, he's just not focusing, and he's just squirming around a lot. But it's really, poor kid's anxious or has some stressors going on in his life.
Okay. So that anxiety, can look very similar to ADHD and kind of present with the same symptoms. So the psychological testing would actually help clarify, hey, is this really is a primary issue here? Is it ADHD or is it anxiety or depression or mood issues?
Yeah. Yeah. Because then, like, as you know, like that's going to totally change the treatment plan. Because, if you give a child who's misdiagnosed with ADHD stimulant medication that turns out they were actually suffering from anxiety or depression or something, that could have some, not good effects, not good response to medication.
Right. That technically could make them worse, right?
Yeah.
And it could make their anxiety worse because now they're going to be hyper-focusing on that anxiety.
Yeah, exactly.
Or whatever issue it is.
Yeah. Yeah. And I've seen, unfortunately, some kids who are misdiagnosed with ADHD who took stimulant medication and, they had some side effects like appetite suppression that's normal and stuff, but some that they got a lot more agitated, irritable. They were just mad and mean.
Mm-hmm.
And I've had a handful where it's rare, but it happens where it causes a full-blown psychotic episode. I had a little 7-year-old I'm thinking of, misdiagnosed ADHD, pediatrician gave him some Ritalin, and then mom's calling me saying he's on top of his dresser. He's screaming that there's bugs everywhere, and I don't know what to do. There's no bugs, but he's screaming that there's bugs everywhere. And we had to found out it was just a bad reaction to Ritalin, and it caused the poor kid to hallucinate. And it can
also cause insomnia too, right? Which can also lead to that psychosis or hallucinations, paranoia, right? So people might not eat, they might not sleep.
Mm-hmm. Yeah, absolutely. Yeah. So that can make a big difference too. And messing with sleep, because that just has a cascade effect. Yeah, you got kids or adults who it suppresses appetite, so they're not hungry, like you said. They're not eating, and then their sleep's messed up, or they're not able to sleep. I've seen in young adults more than kids also stimulant medication triggering like a manic or hypomanic episode, where they took and then they were up for 3 days, talking 100 miles an hour, grandiosity, stuff like that. So
no, that's a good point. So let's say somebody who actually has a mood disorder like bipolar disorder, if they're prescribed a stimulant, then that can cause or induce mania and cause them to get worse.
Yeah, in my experience, but I guess I should clarify or put the disclaimer that I'm not a psychiatrist. I don't prescribe. So this is just more my personal thoughts and stuff. But when it comes to medicine, I always say, hey, refer to this psychiatrist, this nurse practitioner that I trust, because they're going to be the expert on the medicine side.
Right.
But yes, in my experience, I have seen people who, were misdiagnosed ADHD, really had a bipolar, whether bipolar 1, bipolar 2, rapid cycling, cyclothymic, something like that. And they had a bad response to stimulant medication too. Yeah, it can trigger some mania or makes their insomnia worse, or it can have some bad effects. But I guess on the other hand, it sounds like, I'm talking all bad about medicine. On the other hand, in the ADHD world and anxiety and depression, there's been plenty of times too where it's been night and day, like a lifesaver.
Right.
Where, I got so many where we accurately get a kid diagnosed ADHD and I get a follow-up from the parents 3-6 months later, a year later, like, little Billy's doing amazing. It's just turned him around. He's on the honor roll now and teachers love him. And, when a year before he's in trouble all the time and he's failing every class. And so, getting like medicine obviously can have just huge effects too, in the positive way.
Absolutely. Absolutely. It can be a, lifesaver, game changer for a lot of people. But I think that's what we were kind of, talking about is basically we have to make sure that the diagnosis is correct. Right. And then there's not 100% way of guaranteeing that a diagnosis would be correct, but we can get it pretty close to that. Right.
Yeah, that's the idea. Yeah. There's even with our testing, there's going to be some imperfections or some times that it's off, but it's not a perfect science. But my philosophy is more data, the better. Mm-hmm. So, the psychiatrist gathers data. Our evaluations is more data points, more ideas, more explanations of what's going on. But it's still not a perfect science. And sometimes things still get missed.
Right. Okay. And even, I've noticed clinically from my own experience, even antidepressants can kind of cause that too. I've seen antidepressants save lives, but I've seen it also kind of hurt people if they're not really having depression or anxiety, and it's more of a mood issue. So, I think that's where the psychological testing really comes in. I've seen it to be like a priceless tool, meaning that can really help us to, figure out what the treatment plan would be, what medications might be more